Your opponent, Jack Bergman, says his #1 priority would be to repeal Obamacare, the Affordable Care Act. However, the Affordable Care Act prevents insurance companies from denying people coverage because of a pre-existing condition. It also prevents lifetime health cost limits, and it also allows parents to keep adult children covered under their plan up to age 26. Hillary Clinton and many congressional Democrats and senators have proposed creating a public option plan that would pressure private insurers to reduce premiums, and they support letting people over age 55 buy into Medicare. What's your position?
Well, first off, we have to stop playing politics with healthcare. We have an obligation to make sure that healthcare is accessible, affordable, and what we're seeing out of this Congress is, time and again, using healthcare as a political football to score partisan political points with each other, against each other. We got to end that. We've got to fix our healthcare system. There's a number of things we need to get to work. There's a number of things that we can do right away. Number one, we can allow Medicare to negotiate with the pharmaceutical companies to bring down prescription drug costs. Right now, believe it or not, Medicare cannot negotiate en masse with drug companies. Why do you think that is? The pharmaceutical lobby. If we were to allow Medicare to negotiate with drug companies, we could bring down the cost by, I've read estimates, 20 to 30% immediately, our prescription drug costs. $14 billion a year could be saved. Number two, we cannot turn Medicare into a voucher program. Medicare is a program that works. It's efficient, it works. My opponent, Jack Bergman, has continuously said in his own words that he wants to make it into privatize it, make it into a voucher program. That would be a disaster. Ask any hospital CEO what that would do to our hospitals. Also, it would increase the cost and lessen the access for our seniors. Number three, we've got critical access hospitals here in Michigan, in the 1st Congressional District. We have to make sure we keep open. It is imperative that our next member of Congress recognize the importance of our local hospitals and bring back the federal dollars to keep them. And last but not least, we need to give you, the consumer, the ability to go outside of state lines to get health insurance. Right now, you can only go to health insurance companies in the state of Michigan. You should have the ability to go to health insurance companies on a nationwide basis. Thank you.
Thank you.